Social Security COLA 2026. Did Washington just shortchange 70 million retirees again? Did Washington just shortchange 70 million retirees again? The new Social Security COLA for 2026 is finally here, but many are asking, is this really a raise or another pay cut in disguise? Millions of retirees across America woke up to headlines calling this good news. But when you look closer, the numbers tell a very different story. One that's quietly shrinking seniors' buying power year after year. This year's cost of living adjustment, or COLA, is 2.8%. That sounds like a decent raise until you translate it to real life. For the average retiree receiving about $2,000 a month, that's roughly $56 more. If that doesn't make you frustrated, it should, because Washington knows these numbers don't work. The average grocery bill alone has jumped more than 20% in the last 3 years. So why would Washington approve a raise that still leaves seniors poorer? Look at this, straight from SSA.gov. When inflation rose faster than expected, Social Security's formula lagged months behind. By the time adjustments hit, seniors had already spent the extra cost out of pocket. That's not a raise, that's a reminder that Washington's math and your grocery bill don't match. If you're feeling like your raise isn't a raise at all, you're absolutely right. The formula that decides your COLA doesn't track seniors' actual expenses. It's based on something called the CPIW, which measures costs for working adults, not retirees. So when rent, healthcare, and prescription costs rise faster than gas or electronics, the COLA formula misses it entirely. This is how much retirees have lost since 2000. According to the Senior Citizens League, purchasing power for Social Security benefits has dropped 36% over the last 2 decades. Now, let's talk about something that quietly eats away at your raise: Medicare premiums. Each year, Medicare Part B premiums rise automatically, and for many retirees, that increase cancels out most of their COLA. In 2025, the premium rose by $9.90 a month. For 2026, projections show another bump, possibly even higher. And here's the part they don't want you to see. Even if your premium stays the same, your Medicare Advantage plan might not. A retiree in Florida told us her plan dropped her doctor overnight, and the new one charged double for prescriptions. That's how fast the system can change. And wait till you see what Medicare is quietly changing next year. These adjustments could wipe out your entire raise before you even see it. Medicare Advantage networks are tightening, while supplemental plan premiums are climbing. It's a slow squeeze that hits retirees with fixed incomes the hardest. Here's the hidden penalty most retirees don't even know exists. The more you work, the more they take back. If you're under full retirement age and earning above $22,320, Social Security withholds $1 for every $2 you make over that limit. Imagine earning $30,000 a year and still losing $2,000 in benefits. That's the hidden cost no one talks about. And this next part, Washington doesn't want you to see it because it gets political. Congress hasn't passed a major Social Security reform since 1983, yet your bills rise every single month. Lawmakers debate, delay, and deflect, while trust fund depletion creeps closer to 2033. Look at this, straight from the Social Security Trustees Report. Without congressional action, benefits could be cut by about 23% in less than 10 years. That's not future speculation. That's written in federal reports. For millions of Americans, that means tough choices, choosing between heating and medication, groceries and rent. You earned these benefits after decades of work. You shouldn't have to fight for them. A viewer from Texas told us, "My raise covered one grocery trip. That's it." Another from Ohio said, "I've worked 45 years and my Social Security barely covers my rent now." These stories aren't outliers. They're the new normal. And that's why seniors are losing faith in the system meant to protect them. But there is hope. And this is where smart retirees are beating the system. Some are adjusting by delaying benefits until 70, maximizing their monthly payout. Others are reviewing Medicare options each fall to catch lower premiums. And many are using retirement calculators to plan withdrawals strategically, so they're not penalized by income limits. You can't stop inflation, but you can stop losing money to the system. Here's the bigger question. If everyone sees the problem, why won't Washington fix it? Politics, plain and simple. Both parties agree that Social Security needs reform, but neither wants to be the one blamed for cuts. So they stall while retirees pay the price. And every year, inflation eats away another slice of purchasing power. Since 2000, average benefits have lost the equivalent of almost $500 a month in today's dollars. That's not just numbers, that's dignity lost at the checkout counter. Now here's where things take a surprising turn. Medicare is adding something brand new for 2026. It's called pre-authorization expansion, meaning more services will need approval before coverage. Doctors warn this could delay care for seniors with chronic conditions. And just when you thought it couldn't get worse, these policies may also make it harder to switch plans mid-year. That's why staying informed isn't optional anymore. It's protection. So what can you do right now to stay ahead? First, check your My Social Security account at SSA.gov. Compare your 2025 COLA notice to your Medicare statement. See how much of your raise is being eaten by premiums. Second, review your Medicare Advantage or Part D plan during open enrollment. A small change in coverage can save you hundreds. Third, consider tracking inflation categories that matter to you. The government uses CPIW, but your real-life inflation might be far higher. Write it down, calculate it, and share it. Public awareness drives political pressure. The truth is simple. Retirees aren't asking for luxury. They're asking for fairness. You paid into the system for decades. You deserve a retirement that keeps up with reality. Do you think a 2.8% raise is fair after decades of work? Or should seniors get a raise that actually matches inflation? Drop your answer below, because your story deserves to be heard. And if you're tired of being left behind, share this video, because until we speak up, Washington will keep calling cuts a raise. Coming up next, I'm breaking down how the 2026 Medicare changes could tell Washington what you think. Your story matters more than their numbers. Make sure you're subscribed, because the next few months could decide how much you actually take home.